Hey everyone, thanks for joining me on another episode of the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today, we have two gentlemen from MD Revolution. We have the CEO, Kyle Williams, and the VP of Product Management, Michael Moore. How are you today?
Doing great. Thank you.
Great. Awesome. Let's kick it off. Kyle, we'll start with your background, and then we'll kick it over to Michael, and then we'll dig into MD Revolution.
Sure. So my career has been in and around implementing and getting value out of technology across a variety of different sectors, healthcare, consumer goods, big pharma. And then for the last 10 years, I've been involved with investing in early stage companies, of which one of them was MD Revolution. And so that's kind of my path to MD Revolution was first as an investor and now as the leader of the CEO.
Yeah, and I'm Mike Moore. I'm the Vice President of Product Management for MD Revolution. So over my career, I've worked in a variety of kind of technology companies and services companies, always with a focus on health, activity, and wellness. And over the course of that career, I've been able to move kind of closer and closer to the exact point where care is delivered to the patient. So I'm responsible for the software technology that our clinicians or our clients' clinicians use to actually manage the day-to-day care and all of the interactions with the patients and the multiple ways in which we do that. And also lead the team that provides the electronic healthcare integrations to give us really deep integration that takes our workflows and the work that we do for practices and gets it right into the existing workflows, whether it be in Athena Health, Greenway, Azalea, each different EHR, making sure that the practices have access to our teams and what our platform does, but don't have to leave the tools that they use day to day to manage their practice.
Super interesting. Yeah, I mean, there's always product always has such a anyone touching product has such a difficult job. A good product can make or break a company, and you have to be at the forefront of it. And Kyle, it's so interesting to hear. I would like to say that pathway is one that I've never. I love hearing when investors are like, you know what, like I love this company, I want to be involved, and so it's always great hearing those type of stories, and also the success rates of from what I've seen of the companies where the investor decides they want to be like a part of the company. They tend to do really well. So I'm really excited for you and the team. Kicking it back to you, and then we'll go back to Mike. Give us, for the audience that maybe hasn't heard of MD Revolution, give us a brief overview of the company. You can both take parts of it. Kyle, you can just take it, and then we can dig into some insights.
You bet. As Mike started to discuss, MD Revolution is a remote care management company. And so our goal is to make the patient and care management process and experience as good as it is in any other industry. And that's, really a struggle in healthcare because it's so fragmented between inpatient stays, specialists, patients bounce around, with different insurance plans and coverages. And so it's just a really complex, from a patient's perspective, a complex, experience. And so we're really trying to, as Mike mentioned, really bring the healthcare that can be delivered at home with the help of devices and other data sets and outreach to really connect patients back to their care plan, right? What is it that will help a patient to get better? What proactively can patients do to stay well? That's really our mission is to connect as many patients with as many providers and care teams as we can. And right now we're really focused, kind of interestingly, on the Medicare population. So seniors, right? And, there's probably some skepticism. We see it all the time with physicians about the senior population adopting technology. Will they use connected devices? Will they text with us? And the answer is absolutely yes. So the good thing too for us is that Medicare has really been at the forefront of developing payer models and payment for these kind of services. which, you know, those incentives have to be there in order for the healthcare system to change. So we're really latched onto that sector right now. How many Medicare patients can we get connected to our platform, which really connects them back to a care team, either our care team or the provider-based care team, so that they can get the help they need for the 99% of the time that they're not with their physician, right? And that's where a lot of these things, that's where we see the breakdowns in adherence to medication, adherence to diet, adherence to just understanding people's everyday life and making sure that they're on the plan that a doctor thinks they're on.
Yeah, and I think that's a great introduction. I think, you know, and it's really picking up on that idea of understanding what can take place in between a traditional office visit. And I think that where we go even a step farther is saying, you know, it's not just a single episode or a single, you know, visit outside of the office. It's actually a series of very high touch, kind of high coordinated activities with a patient to keep them engaged. So instead of a phone call in between their office visits, it's a series of calls, ongoing messages and reminders, as well as a care experience built around what the patient's goals might be, as well as what their health goals are from the provider who has prescribed that service. And so, you know, where it's providing that and a technology that helps us kind of keep track, coordinate, and focus on each of the patients that need the help in a way that gets them, you know, a higher level of engagement and adherence, but also, you know, with remote patient monitoring or just the coaching interactions that we have, collecting more and more data that does make that next office visit all that much more valuable. You know, every time we are getting someone to take their blood pressure, we're not only able to better care for them, but we're giving data that traditionally has not even been available to the provider to be able to see in the electronic health record at the point that they're seeing the patient for the next visit. So it really does improves the patient experience, but also is providing more and more data to the overall view that the provider gets to really effectively manage care.
Let's stick with you here, Mike, because you said something that I want to keep going with, and then we'll kick it back over to Kyle. What are some of these key insights that you and your customers have learned over time?
Yeah, I'd say the number one key insight, and really is a big premise of just how our technology was built and why we were founded, was that, you know, engagement happens over time and at a human connection level. And so, you know, we know that patients are aware of what their provider or what they maybe should be doing from a health perspective. But we found that in order to effectively take care of the patient, we need that health information, but we also have to spend the time to understand what are their motivators and what's going to make them adhere, and whether that's them or oftentimes, you know, one of their children or someone that is really applying some incentive to pay more attention and keep some of these things more top of mind. And so I think what we learned is that, you know, effective care management doesn't happen at a single point outside the visit. It's a series of interactions. And sometimes the information we get is very concrete and data measures. And other times it's a little more just listening and beginning to hear things a little bit sooner than might come up or might pass that threshold of when a patient's going to bring it up to their doctor. So, you know, I think we found it's as much art as science in care delivery, and using the tools and the data to help tie that together. But if anything, I think we found that human connection is really important. And, you know, and then getting that and capturing that data so that it can be used you know, by the providers, but in a way that, you know, I don't think you can manage those interactions if you're not really focused on that type of patient engagement. And that's where, you know, we come in from a services perspective, but also from a software perspective, is to be able to take on what is a really specialized function in care delivery that is very different than what has traditionally happened inside an office or a medical setting.
And now, Kyle, if there's anything else you want to add to that, I also want to add a part 2 to that too. So if you add anything else, also dive into this a bit. You know, what are some of these customer outcomes that you've seen as well?
Yeah, I mean, I think the first thing, I think the real insight, I mentioned it before a little bit, but the insight that patients will adapt these technologies if they're simple, if they're easy to use, and if they know that someone is actually watching right? So um, many cardiologists, for example, will prescribe medications and to patients, and they want them to take their blood pressure every day. Um, Patients will do that, especially if they know that the physician is then actually watching the data come in on a daily basis and can help them. Right? It's not just a, hey, I'm watching you to, make sure you're complying, but they're watching them to see if it's actually having the impact on their blood pressure or not. And then, seeing the side effects, as Mike mentioned, just the blood pressure alone may tell you something, but also, the side effects, they feel queasy. They're having problems, urinating. Like, what are the side effects that, people will then not take the medication because it makes them feel worse, right? So it's those kind of things. It's that feedback loop, right, of these small incremental changes in health, and or what we're expecting, a prescription or a plan of care to do. It's getting that back in front of the clinician, of the prescriber, the diagnoser, to say, hey, is this what you intended to happen? Are these normal side effects? So it's really that feedback loop, I think, is really important. And it's just in those little interactions, they really add up to, to big changes in, preventing readmissions or preventing, out of control situations.
And, as it relates to just remote care management, right, where it's at now, I guess I would love to be able to also dig into some of the trends that you're both seeing in the space, um, and also maybe some guidance around, how are these practices preparing for these?
Yeah, I mean, I'll start. I mean, I think the biggest thing that is a barrier to adoption is trust. And so I think it's really, again, it's about buy-in at the physician level, at the practice management level, to say, hey, look, we have a way of taking care of patients today, that's very reactive, right? It's very appointment based, and that really it really constricts access to care. And so they have to trust a partner like us, both from a technology perspective and from a care delivery perspective, if we're engaged in that, to really open up that circle of trust, right? To include us in that process, and to understand our roles, right? Like, we're not diagnosing, we're not prescribing, but we're listening, and we're under their supervision typically, right? To really connect that 24/7, listening, diagnosing, data gathering process, and then to do something with it on the back end. So that's, I think, to get ready, they have to have the mindset that, A, this works, that that their patients want it, and that it's not going to be an overburden to their practice, because they're really set up for, again, getting patients in and out the door, right? And so we're oftentimes exposing them to a whole potentially bigger set of data, problems, feedback, and they have to kind of trust us that we know how to triage our way through that and to escalate the right things back to them at the right time based on protocols, right? So I think that's just, again, it's an expansion of mindset.
Anything you want to add, Michael? If not,
No, I think that's great. I think Kyle captured it exactly.
well, my last question for both of you is, what's next? Right? What can you tell us here today? I know when I ask that question, there's things you can't tell me, and that's when usually people smile, because they know something, right? But what can you tell us here today in terms of what's next? And I know that's a pretty broad question, but what's next from the product side? What's next from just general, like, organizational overview? That could be a multitude of things, right? But would love to hear what's next.
I can start off first. So, I think, as this relates even back to our clients, we are, in a business of taking care of patients, and we're collecting a lot of data along the way and giving a lot more actionable information back to the practices and the care of patients. And so even for ourselves, kind of what next really begins to be continuing to take advantage, learn, and take those insights from that data and from the interactions with the patient, and make that actionable for next steps for how to best manage the patient's experience over a number of months, and how to really tie back to really the important measures for an individual patient, but also for the practice. And so, as we use remote patient monitoring data, our health coaching data, assessments, all those things are collecting data, which then become really, there's a kind of a health logic that goes into and turning those back into actionable tasks for our care team, in many cases, or the practice's care team to incorporate into care management. And so, I think the biggest trend now is seeing that all these things, that care management is not just a silo of one experience that's taking care of the patient, but really can work holistically for all the health goals to really tie in reminders and activities for patients' preventative care, not just managing the patient, the diagnosis that we have or the conditions that they're managing today, but really work with the practice to identify screenings and care gaps and all those things, so that those care management experiences all have that tied in. And when we do the difficult work to get a relationship built with the patient and be talking to them on a regular basis, that we can be taking care of a wide variety of their needs at that point, and really allow everyone, then the provider and the health, the practice, to be able to then really manage the point where we have patients that do need the individual in-office approach, and having them come back in with a set of data and actionable steps to make the most of that visit, as well as use that visit, as Kyle said, to reinforce for the patient that the provider is concerned about their ongoing health, and their participation in this program helps that. So, a long way of saying, I think we've just started to connect the dots, and there's some really exciting things as we see those pieces all tie together, and especially with the integrations that we do with the EHR, where all the information we've collected goes right back into their tools so they can use it in their analysis as well, and understanding, how these programs are, benefiting patients, but also affecting the overall cost of delivery of healthcare in the right places, and reducing the, unnecessary emergency room visits or readmissions, but keeping a focus on the right investment of their primary or specialist's time in helping to manage their health.
I love it. Well, I want to thank both of you so much for joining me here on the podcast today. Hopefully we can have you both come back on in the near future and talk about some more topics, but really appreciate it.
Yeah, thank you.
Great. Thanks for having us.